Hey there, welcome. It is so good to have you with me today. Thanks for making time in your day to join me for this little mini class. Just a reminder to anyone who might watch this as a replay, please remember to like the video, drop a comment, share it, subscribe to my channel. Doing all of those things helps to make these videos more visible to a broader audience. And I really appreciate your help with that. Hi, Professor Petty. So good to see you here. Welcome. We are seeing some new people and some people that have been with us for a while. So it is so good to have you with me today. Today, we are talking about what the iRights can teach us about digestion. Specifically, we are focusing on the stomach. Digestion is a whole long process. We're going to focus really just on the stomach today, and we only have time to just touch the tip of the iceberg for this. A reminder that this information is meant for your education only. It is not meant to diagnose or prescribe, and you are responsible for any results, good or bad, that result from using this information. And I love that Jennifer has introduced herself saying she's new to this. She's a biomagnetic paratherapist. I love that. It'd be great if you would each take a moment and just drop a comment in that chat box and let me know what your background is. Are you new to Iridology? Do you have holistic health training? The more I know about you, the more I can tweak this presentation on the fly. I've been teaching for over 4 decades. I'm pretty good at doing those modifications as we go. So this is so good. Oh, Professor Petty, I just got to do a little congratulations here. He's been working so hard to get his anatomy and physiology done, and he's got it done. Yay, congratulations. We need to talk, don't we? Fantastic. Michelle Stornello is a naturopath, and this is so fantastic. Excellent. So good to have everybody joining us. Welcome, welcome, welcome. I'm going to take a minute and kind of flip the order of things around a little bit for what I usually do this in. Usually I do information first and then I introduce myself, but today I'm going to introduce myself first, and then we are going to dive into the content that we are going to cover. I am a level 3 IPA certified iridology instructor. There are only, last time I counted, which was just a week or 2 ago, there's only 8 of us worldwide so far. And I mean, I've been an iridology instructor for a lot longer than that. IPA introduced the level 3 in 2022, and I was one of the first 3 to hop in and do the training and pass the certification exam. I've been teaching and practicing iridology, nutrition, herbology for over 4 decades. And I've studied iridology with 8 different instructors, 3 different styles. I designed and taught a lot of courses. In university, I was actually training to be a school teacher. And I was really just 2 semesters shy of graduating when I got married. But I also decided I did not think I liked other people's kids well enough to spend all day, every day in class with them. And it turns out I was right, that I'm really much happier teaching adults. And so that's the internet has just blown that wide open for me, and that's exciting. I am a nutrition professional. I'm affiliated with the Canadian Association of Holistic Nutrition Professionals and the Canadian Association of Natural Nutritional Practitioners. And I'm also a master herbalist. I got interested in health as a teenager, and my family was very medically oriented. Everything was, if there's a problem, you go to the doctor, you do what the doctor says, right? The doctor owned your health. That didn't resonate with me even as a teenager. I felt like the doctor should be a mentor, that he should be helping me figure out what was wrong and then teaching me what I could do to improve it. But that's not how the medical system works. Didn't work that way decades ago, and it still is not working that way now. So that is a whole lot of why I've gone very holistic, because I love teaching students and I love teaching my clients. I consider my clinical appointments to be one-on-one mentorship sessions where I'm teaching my clients about what they can do to get control of their health. And I really, really enjoy that. And it's what I value in the professionals that I access for my own health as well, because we all need an A team, right? We all need an A team. All righty. So I love that lots of you have dropped comments into the chat box. That is so good. So very, very good. and it tells me that you know how to use the chat box. So this is an interactive training, which means that as you have questions, drop them into that chat box. And if they fit in with what we're talking about, I'll incorporate it into the presentation. If they're way off topic, I'm sorry, they're going to get ignored, right? There's only so much time in a day. All right, so that's me. That's me. Let's talk about digestion. All right, so when we look at the iridology, we look at the iris, right? We look at the pupil, and we look at the sclera. We look at everything we can see on the eyeball. And each of these things teaches us different information. And today we're going to do a 30,000-foot overview of a couple of the markings in the iris that teach us about digestion. We certainly don't have time to do all of them, but we will do a couple of them. Oh, and just coming back here, whoops. And of course, we are talking specifically just about the stomach. Digestion begins in the mouth, and I know you already know that. It continues on in the stomach, and there is a certain amount of digestion that happens in the small intestines as the body is beginning to assimilate nutrients, and we get a lot of assimilation in the small intestine, and we get the final lot of assimilation happening in the large intestine. So we're really focusing on the stomach. We know the liver is an auxiliary digestive organ. We know the pancreas is an auxiliary digestive organ. But today, the story is the stomach. Alrighty, so when we look at an eye, and we're looking for stomach markers, we're specifically looking at this area between the edge of the pupil and this ring. This is called the nutritive zone. This area teaches us about the stomach, the small intestines, and the large intestine. So of course, we're going to narrow that down today. There's no one marking that is a guarantee of anything, right? The irides teach us about genetic potentials, not about diagnostic absolutes. So I'm not going to be able to name a disease from what I see in the eyes, but I can understand the pathology. I can understand also the physiology. How did this person get to this point where they have the symptoms they've got? What do their eyes teach me about the weak links that help them to get here? Now, it's also really important to remember as we're looking at eyes that we might not even see a marker in an eye, but the person might have a problem in that area. Why would that be? Well, that could be that genetically their body may have been strong and resilient in regards to that, but this person has just driven their body into the ground. They've maybe done absolutely nothing to take care of themselves, and so they've earned the right to have the problem. There was no genetic predisposition, but they've done a really smash up job on damaging what they've got. That doesn't mean they can't correct that mostly or 100%, but it does mean that we're going to have to work with them to get them to change some habits, right? So again, when we look in the eyes, we are seeing inherent predispositions, what has been passed down from generation to generation. That means we need to have a conversation with our client. I may see predispositions in this iris that suggest certain problems, but maybe this client was really smart. Maybe this client figured out what they needed to do to feel well, and they are doing those good things, and so they are not having any problems. Does that make sense? That just because we see a marker in the eye doesn't mean there will be a problem. If that makes sense to you, give me a make sense in the comments box. Jennifer says, fascinating. Yes. Fantastic. Thanks for that, Jennifer. So good. So good. So people can have digestive markers, but they might not have any symptoms. Maybe they are too young for the symptoms to have manifest. Maybe they're doing enough things right, either by default or on purpose, right? So it's also possible then, as I mentioned earlier, to have digestive concerns but not have a marker. And that could be because the person has done enough awful stuff to their body. Just going to tell a story out of school, as my mother used to say. My husband used to go out of town to work periodically, and he was heading out of town, and he broke a tooth the night before he was supposed to leave, broke it badly, didn't have time to get to the dentist. So he had this really, really awful toothache. He thought, I'm only gone for 5 days this trip. I'll make an appointment to see the dentist for as soon as I get back. And he started piggybacking. Okay, this is the herbalist's husband, right? He started piggybacking Tylenol and Advil. So he was taking 2 extra strength of each of those, like at 8 o'clock, and then 2 of the other one at noon, and 2 of the other one at 4 o'clock, and really just dosing up. After about 3 days, and we talked daily when he was out of town, but after about 3 days, he called me and he said, I don't feel good. I said, no kidding. What are you feeling? He said, I've got this gnawing gut pain, like in my stomach. It is awful. I said, well, sweetie, you've just given yourself an ulcer. I mean, he's my husband. I can diagnose whatever I want with him, right? And he went, what? And I said, yeah, I know what you're doing with your meds right now. You've given yourself an ulcer. And sure enough, I mean, he had to keep those meds going till he got home and got that tooth fixed. But then it took us a month to heal his stomach. He did not have a genetic predisposition towards an ulcer, but he did everything perfect to set up an ulcer for himself. So there was no marking in his eye because that was not a genetic thing. So on a basic level, there are 3 specific indicators that teach us about digestion. We're only going to talk about one of them in any detail and another one a little bit today. And when we understand these, and when we understand our anatomy and physiology, so Professor Petty, this is going to make so much sense for you. We begin to understand how everything interplays and what we need to do. And this is exactly why it's critical that you have that solid anatomy and physiology training before you start learning iridology. I know I've had Facebook chats with some of you, and I ask you, have you had a college level course in anatomy and physiology? A 60 instructional hour course, because that is foundational. And so it is so, so important that we have that. Otherwise, we're just matching one symptom with one marker, and we can't connect markers, and we really can't get very far. So today we're going to look at one of these markers specifically. Jennifer says, look for the book, The Secret Lives of Teeth. Wow. Ooh, that sounds interesting. That sounds interesting. All right, here we are. This is the eye of a 17-year-old. She had been a client of mine since before she was conceived. I took care of her parents for a couple of years before they conceived her, and then, of course, continued taking care of the whole family. This marker, if you're working on like a phone screen, it's going to be a little hard to see. If you're working on a tablet, you might see it. If you're working on a larger screen, it should be pretty easy. I want you to look at the very edge here. Can you see how it looks like someone took little scissors and cut little snippets into this inner edge of the iris? Can you see that? If you can see that, put snips in the comments box. Can you see that? Jennifer's got that. Excellent. Who else can see that? Can you see this? Fantastic. So good. So good. All right. Okay. So this is not present in everyone, but if it is present, it is inherent. It's been passed down from the last 3 to 4 generations. It tells you something about some of the challenges that the predecessors in this bloodline likely faced. We are not going to be able to get rid of this. It is a genetic marker. However, what it suggests, we can manipulate on a physiological level. We can change how the body functions within its genetic capabilities. This marking suggests a greater predisposition to an inefficient or insufficient stomach lining. All right, so quick quiz here. What does the stomach lining secrete? What does the stomach lining secrete? Bile comes from the liver, so it's not going to be bile. What does the stomach lining secrete? And what is the primary macronutrient that is digested in the stomach? Michelle, congratulations. We're talking about hydrochloric acid. Yes, 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 yes. And what is the primary macronutrient that our body uses hydrochloric acid to digest? Michelle, are you impressed that I understand French? What is the primary nutrient that we use hydrochloric acid to digest? Because hydrochloric acid doesn't work on everything. What is it? Not sugar. Sugar is a carbohydrate. So sugar is going to need an enzyme like a sucrase or something like that. Elena, yes, protein. Well done. Well done. Fantastic. So we also want to then talk about how the stomach lining is structured. And actually, I think I've got an image of that coming up. So we'll leave that for a moment. So the hydrochloric acid is produced by the stomach lining. Oh, we'll talk about stomach lining for just a second here. So that stomach lining is convoluted. It's if this is the stomach wall, this is the inside of the stomach, and it's got these little villi in there. At the base of the villi, we have cells that secrete mucus. At the tips of the villi, we have cells that secrete hydrochloric acid. Hydrochloric acid is there to digest protein. Your stomach is protein. Oh my goodness. Anyone see a problem here? That if we secrete hydrochloric acid into that stomach and it has no protection, then we are going to use hydrochloric acid to digest the stomach lining. So Aya is saying, can't see everyone's comments. Change to everyone, pretty please. I have all of the comments set up for everyone, should be able to chat with everyone. Aya, so I don't know what's up. I don't know if there's a setting on your end that you can change. Okay, might be fantastic. Have a dig and see what you find. So we've got the mucus secretors here, right? And their purpose is to secrete mucus. Yes, there is a good, healthy use for mucus. We need it in the stomach. Secretes mucus all over these villi to protect them from the hydrochloric acid so that the hydrochloric acid can act on protein, right? When we see comb teeth, we know that this person's ability to secrete that mucus to protect those villi is genetically compromised. And the body is smart. If the body goes, I don't have enough mucus protecting all of my lining, I better not secrete so much acid because I don't want to damage myself. I don't want to digest myself, right? So when we see this, we are going to be asking our client questions. What kinds of questions would you ask someone if you thought they were not digesting protein well? What kinds of questions would you ask someone if you thought they were not digesting protein well? While everyone's thinking about that, Jennifer, no, because vegetarian, you still want proteins. Only I'm going to say that it's actually a more difficult thing to digest plant proteins because every plant protein is heavily embedded with carbohydrates. It's a really hard combo to digest. Are you feeling tired or sluggish? Yeah. Not raw nor high oxalates. I'm not understanding that piece of question. Tired or sluggish is one. My favorite question here is, are you gassy? Do you burp or do you fart? If they burp, I know it's probably a carb problem. Heartburn could be important here, as could headaches for a couple of different reasons. But if they're farty, then I want to know, is there an odor? If they're just passing air, no big deal. We all swallow air, it passes through. If it smells a little bit like, oh yeah, there's an odor, but oh well, that's a carbohydrate fart. If it's a who died here fart, that is protein. That's protein not being digested very well. These people will often also say that when they eat red meat, it sits heavily in their stomach. Red meat, pork, animal proteins, chicken and fish tend to be a little lighter. They tend to digest more easily, but the heavier meats sit heavily in their stomach. So when we see this edge, we know that this person inherently is not, is more prone to lacking hydrochloric acid, likely because they don't have enough of a stomach lining that secretes the mucus. And we're going to need to work with on both of those. We're going to need to build their hydrochloric acid, but we also need to support how they secrete mucus at the stomach level. Here's a fellow in his 60s. And again, you can see clearly that he's got the comb teeth, that rough edge where it looks like he's got little snippets in there. So again, this suggests that he likely doesn't secrete acids well. Now, that's a challenge because typically by the time we're 35, we start losing our digestive acids anyways. And by the time we're 55, we're down by half. This fellow is 60. So his age is playing against him. So we're likely going to need to make sure he gets enough hydrochloric acid in his diet. Now, remember, mucus is a mixture of carbohydrates and proteins. So even building his hydrochloric acid is going to make it more easy for him to secrete mucus at the stomach level. There's a few other digestive indicators here, but we're not going to dig into those really deeply today. Here's a picture of that stomach lining. So if we look at the stomach lining, not super magnified, we've got the wall and we've got the villi, or the area that's pointing into that hollow. Here, if we take one of these little sections and blow it up, we've got the gastric pit here, where we're secreting pepsinogen and HCl down here. We've got all of this, and I had that backwards. I apologize. I said we secrete the acids from here. My apologies. We secrete it from down here. I get that backwards every time. I want the acid to come out of the tip, not out of the pit. And so, but this whole villi secretes mucus to protect itself from all of these digestive juices, the pepsinogen, the gastrin, the HCl, that are coming out of the gastric pit. Okay, so we really need to make sure we are keeping those gastric pits healthy, and we really need to make sure we are keeping the mucus secretion good. How many times in any of your holistic healing training have you heard mucus is bad? That we need to get rid of mucus because mucus is acid, that's bad. If you've heard that, let me know. I know when I first did my training 4+ decades ago, we were taught all mucus is bad. I don't think we understood the role of mucus in various organs. You have to have some mucus in your sinuses or they dry up and crack, and then you end up with nosebleeds and all kinds of things. We have to have this mucus lining our stomach. We have a mucus layer lining our intestinal tract. We need mucus in some places, right? And Lori says, except for needed for moisture. And that is where we need it. We need the mucus as moisture. Actually, our lungs need a very fine layer of mucus. But of course, if we've got too much in any of these areas, that's the problem. So it's the balance of the mucus. How much do you have? How thick is it? How well does it work to do its job? Do you have too much? Is it getting in the way of things? So it's a real, it's a balancing act, right? All right. The next indicator we're going to look at is called the stomach ring. So when we look again between the edge of the iris and this ring, can you see that there's a band of denser tissue hugging the pupil? We've got comb teeth here, but can you see this band? It looks kind of like a pom-pom going around the pupil. If you can see that, give me pom-pom. Lori says, yep. You see the pom-pom? This correlates directly to the stomach zone, the stomach as an organ itself. Okay. When we can see this clearly, it tells us there is a predisposition to some kind of an inefficiency or insufficiency in the stomach itself, in the way it's going to function. And we dive deep into why that is in the dynamic iridology assessment system course. So when we can see this, if it is absolutely pure white, and I mean take a piece of white paper, hold it up, and if it matches, then we know this person is genetically over acid in the stomach. I will tell you, I've never seen someone who is actually genetically over acid. If that band is any other color, the fact that it is visible tells us this person genetically, again, has an inefficient or insufficient stomach. It's not uncommon to see comb teeth and the stomach ring in the same person, in the same eye, right? And so we know that we are going to need to talk about how well do you chew your food. We're going to talk about what kinds of things are you eating and drinking, because there are certain things that that people routinely put into their mouth that should never be seen in the stomach, right? So we talk about that. We talk about, are you gassy? And we work with this. And yes, that Michelle is saying that is the sphincter pupillary or the pupilary sphincter. Indeed, it is. And it correlates perfectly to the stomach. Sometimes we see people who, and this also has that pupillary sphincter. You can tell because of the color of it that it's there. We can't see the edge of it because of where this ring is sitting. But sometimes, even if the stomach looks like it's pretty good, which it rarely does, but sometimes it might, can be other things that will impact digestion. One of those things is this person a sympathetic nervous system responder? People who have these rings going around their eyes tend to be sympathetic responders. They respond very intensely to any and every stress. And the stresses might not be what you think they are. This is a young boy. He was 10 years old when we took his photos, and he was being assessed by the doctors for ADHD. For him, a stressor is a pencil dropping in the classroom, a fly buzzing by. He's not able to focus well, easily distracted, right? These people tend to internalize every stress, and they tend to need to be always busy. So they often don't chew their food well. Michelle is saying the parasympathetic needs to be addressed. Yeah, parasympathetic may need to be supported. Sympathetic needs to be supported as well in a way that brings it into proper balance with the parasympathetic. So we're never just working on one aspect of the nervous system. We've always got to balance both. And so you can imagine with someone like this who internalizes their stress, is always on the go, never takes time to chew their food, that's going to have an impact on digestion. If we see that with someone who's got comb teeth or a stomach ring or any other digestive system marker, how do you think it's going to impact their digestion? They are likely not going to be able to digest well. Jennifer says, not well. Well said, Jennifer. Very succinct. Love that. Not well. Professor Petty is saying diaphragmatic breathing, walks after eating. Yeah, absolutely. Not having a device or distraction at mealtime, literally putting your behind in a seat at a table and taking 20 minutes to eat that meal, right? Posture is important. You're right. Absolutely. If you're not chewing, the nutrients can't be absorbed. We're going to see a lot of fallout from that kind of a problem. Do you know anyone who's like that? They eat too quickly, and then they are either passing copious amounts of gas or they're complaining of stomach issues. You know, very, very common in this day and age. Very common. This is the little 4-year-old girl, and she's got those comb teeth. She's got a darker stomach zone area. So we know that genetically her digestion is probably programmed to not be the greatest. Now, here's why I'm not worried about that with this little girl. I've been taking care of her mom for many years and took care of her through the pregnancy, through conception, the pregnancy. This little girl is now, I think she's 10 years old. It's been a while. And mom is very, very conscientious. Mom makes sure, actually, this little girl was the result of IVF. We were not successful in doing only natural things to help the parents conceive. And so very wanted, very loved, very adored, but not spoiled, right? Often a single IVF child will be spoiled rotten, and you can't manage them ever. This little girl is not like that. She's really been raised in a very beautiful way. And so mom makes sure that this little girl's meals and the family's meals are cooked from scratch, that there is good protein, that there are good vegetables, that we relax when we eat. We eat together as a family and we relax at mealtime. And these are all things that really help digestion. Mom encourages the daughter to drink lots of fluid, but not with her meals, right? So mom is doing a brilliant job of training this daughter in very healthy habits that will support the digestion and will help this little girl to avoid, or at least stall off for many years, the digestive issues that her eyes say she's capable of developing. So when I see this in a young child, and when I know how the mother is the mother and the father, got to give the dad credit here too, right? The parents are both being supportive. They're both trying to ingrain good habits. I don't worry about it. I don't worry about it. This is a client of mine. She's in her mid-60s. She's one of my longest clients. She's been with me for 4 decades. She started with me when she was 20. And, you know, my clients come in for several appointments, then they're feeling great. So they disappear and they hopefully maintain, but then they get older, things start to fall apart, then they come back in. We do several appointments, get them back on track. Well, she's had a lot of those away sessions and she's coming back now. She, unfortunately, in the last about 20 years, she has become insulin resistant, increasingly insulin resistant, and has gained 100 pounds. She now weighs 275 pounds. Much better weight for her is about 175. A lot of that was very poor food habits. She loved to do jazzercise, but she fell off from doing that. Because of the weight and because of the poor food habits that her husband helped establish when they got married, she's developed esophageal reflux. And so she's got some problems. Now, how familiar are you with esophageal reflux? Do you know anything about esophageal reflux? If you do, spelling test, put esophageal reflux in the chat box. If you can't spell that, just put ER for esophageal reflux. If you don't know much about it. Michelle knows something about it. Fantastic. Professor Petty says, please explain. All right. Does anybody else want me to explain something about esophageal reflux? Jennifer says, please. Okay. Who else? One more. Yeah. Lori knows it. Fantastic. Fantastic, Lori. Glad to hear that. Esophageal reflux is a form of reflux from the stomach where we've got stomach contents backwashing up the esophagus. A doctor will typically always give a proton pump inhibitor for that. They won't stop to check, does this client really have too much acid? Esophageal reflux does not always have the pain of heartburn. It does not always have obvious discomfort. One of the most common symptoms I see with this is a difficulty swallowing, where they feel like they've got mucus congestion up high in their throat and they're always clearing their throat like that, or coughing to try to move this. So why does this happen? There's a sphincter at the bottom of the esophagus, and it is supposed to stay closed. Well, except for when food is going through it. The problem is its trigger for closing is stomach acid. If the stomach does not have enough acid, that lower esophageal sphincter will not close. So if this person is putting in a lot of carbohydrates, which are going to reduce stomach acid, that sphincter is not going to close. And that means that if she overeats, if she drinks too much fluid with that carbohydrate meal, if she lays down after eating, she's going to get reflux. It may or may not burn, but it will cause the inflammation in the throat that leads to mucus congestion in the throat. So she's got esophageal reflux. Her doctor immediately put her on a PPI, which I do that. Really? You put her on a PPI? You don't even know if she's really over acid, which I doubt that she is, because when I asked her, would she do proton pump inhibitor, PPI, proton pump inhibitor? When I asked her if she'd be willing to do an experiment, now remember, she trusts me. We've been together 40 years, right? when I asked her, would she do an experiment, but would she be willing to set the PPI aside and actually take hydrochloric acid instead? She said, absolutely. I've been on the PPI for 2 months and I've seen no result. Of course she hasn't. It's making the problem worse, right? So and I never tell a client to stop a med. That's not my jurisdiction, right? I do not have the credentials to say, stop that med. So I always ask, are you willing to do an experiment? Here's what I would do if I was doing the experiment. I would stop the PPI. I would put the hydrochloric acid in. I would gradually increase that hydrochloric acid a little bit every few days until I saw a difference, until either that throat thing went away or until I literally got heartburn, which would be very, very rare. And so we're doing that with her. And she is finding that as she does this, her throat is feeling more and more clear, right? Because we're now building the stomach acid. Here's another problem with PPIs. They will always compromise bone density because you need protein and you need hydrochloric acid. You need hydrochloric acid to get you the calcium. Calcium also neutralizes hydrochloric acid, but you also need protein along with your calcium and magnesium and your vitamin D and your boron and your selenium and everything, right? You need all of that to build bone density. As soon as you kill the stomach acid, you are going to compromise bone density. She's in her 60s now. She doesn't need to have her bones compromised, right? So she's getting a clearer feeling throat. We are getting some support. How, Professor Petty, great question. How can we promote the hydrochloric acid naturally? Things like don't put carbohydrates with your proteins in a meal. Don't drink fluids with your meals that are protein heavy. But remember, the body's natural tendency is to reduce digestive secretions as we get older. So there likely will come a point in time when we have to supplement the HCl in order to get the nutrients we need from the stomach or from the digestion at the stomach level. All right. All right. So I love what Dr. Bernard Jensen said. Of course, we all know and love him as one of the fathers of North American iridology. We've come a long way since what he was teaching. Iridology's had so much research and so much development that he did a lot of good. We also know that a lot of what he taught doesn't work. What we do know works. One of the things that helps digestion is to go for a little walk after each meal. After your meal, sit a while, then walk a mile. Okay. So a little bit more about the dynamic iridology course. How did that work for you? Did that all make sense, what we were talking about with digestion? Does salt and vinegar create hydrochloric acid? That's a really good question. I don't know test tube chemistry that well. I know a lot of people will use just apple cider vinegar, a bit of honey and water to help with hydrochloric acid. Can you repeat how we can increase HCl naturally, ma'am? You can't. Except for reducing fluid and not eating carbohydrates with your proteins, right? Proteins on their own, like a mono-food meal, or at least eat them, eat your carbs first and have a 20-minute gap after you finish that and then eat your protein, let the carbs move through, right? Lori's saying it all makes sense. Thanks for being here, Michelle. Have a great day. So iridology can help us to assess our clients more quickly, more accurately, and help us develop better and faster rapport, and eliminates the need for an intake form. Now, you still need an informed consent form, right? We need people to sign off saying they know we're not medical doctors, we're not going to diagnose, we're not going to prescribe, but we don't need those lengthy questionnaires. How many of you use a questionnaire with your clients? How many of you do that? I'm going to tell you, you don't need to. When you know your iridology well, you don't need a questionnaire. I've never had a client complain for not having to fill in a questionnaire. The dynamic iridology assessment system course is the only course that is live online for health professionals. So read that as anyone who's got a college level anatomy and physiology course of at least 60 hours. So a separate course on a transcript. And so the idea here is to teach my students iridology so that they can use it as their intake. Find out, what does your client need help with? Look at their eyes, put that together to ask the right kinds of questions, and then away you go. The idea here is to make it so that you don't have to spend your time outside of hours developing protocols. How many of you do that? You see your client and then you go and spend an hour or two or three or four creating a report, creating a protocol to bring back to the next appointment, right? If you do that, we're going to stop that. We want to stop overwhelming our clients. If it took you 4 hours to create the report, it's going to be too much info for your clients, because we want to create programs that our clients can stick with to increase their compliance, their success, and long-term retention. I've got many clients who've been with me for 30 and 40 years. That's long-term retention. Jennifer says, thank you. I agree. Too much of anything is not good, and it can strip the enamel off your teeth. Too much vinegar, or even from its, yeah. And so if my clients want to do vinegar or lemon juice, they do it through a straw, right? They do it through a straw. So a little bit about the course that is starting on June 27th again. 20 weekly, 2.25 plus. They're running 2.25 to 2.5 hours each session now, live interactive web classes like what we're doing today, except your microphones and your cameras will be on. I like to see my students' faces, and we like to have conversations. Each class session is recorded and uploaded to your student site so you can attend it live, but you've got it for playback on demand as well. We do group mentoring via webinar twice each month. You've got questions about iridology, about business, about difficult clients, about whatever, bring it to the mentoring sessions. You get the 225-page downloadable textbook. 45 pages of cheat sheets and study notes are also included as downloads. I limit each cohort to no more than 10 students at a time. I really feel that the best way to learn iridology is in small groups. It allows you to ask the questions you want to ask. And I include the one-on-one mentoring that is required by IPA should you decide to certify. Most teachers charge extra for the mentoring, and no teacher that I know includes group mentoring after your course completion. I include the group mentoring for as long as I'm teaching for. I just turned 65. I'm not planning on quitting any day soon. I love teaching. It is my calling in life. So the next dynamic iridology assessment system for health professionals is starting on June 27th. Professor Petty, I'm so sad. I know you're dedicated. Class will be at midnight your time, sir. And so if you want to join us for it, I'd love to have you. He's been working hard to get there, and that's exciting. This gives you the time for each class in the different time zones. If you've got that A&P under your belt and you want to learn iridology at a professional level, and you're ready to commit to learning this, then I'm going to suggest that you use the link that I'm posting in the chat box to schedule a time to chat with me. Let's talk about you. Let's talk about your goals, where you're at. Do you have the anatomy and physiology you need? How is it you envision incorporating iridology into what you do? The purpose of this call is not a high pressure sales call. It's for me and you to decide, is this course a good fit for you? Is it what you need at this time? If it is, I will invite you to enroll. If it's not, I will coach you in another direction. Professor Petty, I'm going to tell a story about you. Is that okay? Thank you. So Professor Petty and I have had a phone call. We did the call months and months ago, but he did not have the A&P. So instead of inviting him into the course, I sent him a link to connect him with an appropriate anatomy and physiology course. And now he's completed that. So our next step will be, when he's ready, when he's saved up the money for it, we will have another call and give him the enrollment link so that he can enroll in the course. And he's saying true this, so I'm not saying anything that wasn't true. right? There was no pressure. There's no coercion. It's an assessment call to make sure that this is where you need to be at this point in time. I've had the call with a few of you. I've got another student on this call with us right now, and it's never, ever meant to be a high pressure. This is one of my graduates, and she said, this is my first iridology course. However, in my certified natural health professional course, we were given a 3-hour lesson on iridology in a nutshell. That lecture and the study material left me more confused than before I knew anything at all. Judith's dynamic iridology assessment system has been an incredible experience, and we are just halfway through the program. Her teaching materials are thorough and easy to follow. The charts are invaluable and so insightful. I left Western medicine a while ago in favor of natural health. I've been an RN for 22 years. Western medicine wasn't able to help me with my health, but iridology has helped me to identify many of my health challenges and to act to support my body toward better health. I've also been able to guide my family in supporting their bodies. Judith is truly amazing and is my most favorite instructor out of all my many years of higher education. Thanks, Judith. Professor Petty is encouraging you all, just have a chat with Judith. Angela Hodges says, wow, and she posted this on the IPA website under my name. Wow, that's all I can say. What a fantastic course, fantastic teacher that actually cares about your success. I'm so happy that I found her. I had never even thought about being an iridologist, although I had periodically looked for one to go to nearby with no avail. I had one session one time 20 years ago and thought it was amazing what they could tell by looking at my eyes back then. I'm a registered dental hygienist and have been for 20 years, but have been studying naturopathic and homeopathic modalities on the side to help my own family. Now I want to open my own business using iridology to help others be healthier. I've already signed up with Judith for her next class so I can brush up on body systems. So I do teach dynamic iridology. And then for my graduates from there, we have another course that's 11 weeks long, and it combines iridology with herbology and nutrition. We go deeper into the herbs and the nutrition. She wants to learn herbology, so excited. So if you're thinking about taking this course, don't hesitate, you will not be disappointed. Kimberly's in Dallas. If you were wondering which iridology course to take, you can stop looking. You found it. Judith Cobb is an excellent instructor with many years of experience. She is a caring, compassionate person who is dedicated to the field of iridology and her students. I personally practice both Eastern and Western physiology medicine. She has a master's degree in radiology, and she works in a radiology clinic, but she has her own holistic health clinic as well. Was very impressed with the layout of her program. She makes it easy for her students to balance work, life, and study. Professor Petty is saying, or Lori is saying, currently enrolled. It's one teaching not to miss. She has an excellent way to teach. Thank you, Lori. And Professor Petty is wishing Lori the best on her journey learning. This is so good. Thank you. So there again, if you've got that A and P under your belt, and if you're looking for an iridology program, use the link that I just posted in the chat box. Grab that link, schedule a time for us to chat. Let's see if it's going to work for you or not. And if it is, great. If it's not, maybe later, right? And let's just get you going. I've had several students who've actually done the IPA certification course with other instructors, and then they enrolled in my course. And they did that because they said, I learned the markings, but I didn't learn how to use this. And when I asked the instructor, what do I do with this now? The instructor said, oh, you'll figure it out. And that's not what I do with my students. I want to teach you the nuts and bolts. I want to teach you how to integrate it into what you do. My goal is for you to be a successful iridologist. My goal is not to get you to enroll in my course. My goal is to help you to be a successful iridologist and to successfully incorporate it into your business. And that is why the mentoring goes on long term. So with that, my friends, any final questions? Anything else you want to know? Or are we good? Jennifer says, thank you. You're very welcome, Jennifer. Well, it looks like we might be done for today. Thanks so much for being with me. I really do appreciate you taking this better part of an hour to be with me today. And I really do hope that you'll book that call so that we can talk about you and where you're at and see if this is a good fit. Have a brilliant day, and I will talk to you soon. Bye for now, everyone.